Let's talk about facelifts. This is probably my favorite procedure in plastic surgery because it makes such a huge difference. So typically as we age, we might have some loose skin or sagging of the tissues. So what a facelift does is it addresses those tissues, but it's important to know that it doesn't just tighten skin. It actually tightens the underlying kind of muscle layer of the face, and that's what gives you a really nice result and a long lasting result. So who's a good candidate? It could be someone in their 50s or 60s, 70s and 80s. It's when you have a change in your skin and tissues with that sag or loss of volume. So we do see younger patients in their early 50s and late 40s, and there's some truth that, you know, as opposed to when you're in your 70s and 80s, when you're a little bit younger, those tissues are stronger. And so when we move those tissues during surgery, there's kind of more of a dramatic change and a long lasting change than someone who is maybe in their 80s. So in a facelift, you know, one of the goals is to reshape things, right? We're trying to address the cheek. We're trying to improve the jowls. We also lose volume as we age, so often we use fat grafting to help restore volume. So in a facelift, we make an incision in front of the ear and actually it extends into the hairline and then behind the ear. From there, we elevate the skin. Now, it's not just about pulling skin, right? Because that's gonna give you a pulled look that doesn't look natural, and it's also gonna give you a result that doesn't really last. So it's about addressing the deeper tissues. So that's where we manipulate and mobilize the deeper tissues, that deep connective tissue called the SMAS. And that's what we are able to kind of restore and reconstruct, basically. And that's what creates more of the cheek and improves the jowl. So also there's a continuous layer with the SMAS in the neck that's called the platysma. So we're able to tighten that platysma. Sometimes patients have bands, and that's why we tighten the platysma. That gets rid of the bands. And we also tighten the skin of the neck, so that gives a nice contour. So there are risks of the surgery, but we try to keep them very low, and they are rare. Bleeding, infection, wounds, or nerve injury. Your surgery is performed in an accredited surgery center, and you'll either be under IV sedation or general anesthetic and have an anesthesia provider. Typically, the surgery can take anywhere from 5 to 7 hours depending on what combination of procedures you're having done. After surgery, you'll have a small drain, and that helps to get rid of any fluid because when we elevate the skin and we tighten things down, sometimes the body puts out some fluid for the first day or two, and I'll see you back the next day and I pull that drain. So after surgery, you're gonna have some bruising, you're gonna have some swelling. Typically by about 2 weeks, you're looking pretty normal. Social event recovery, you know, you're probably not gonna be ready for a social event till about 4 weeks. And then it takes about a full recovery of no lifting, no strenuous exercises, no pushing, no pulling for about 6 weeks. You know, facelifts are one of my favorite procedures, and I think it can make a dramatic change. So we look forward to seeing you in your consultation. If you have more questions, write them down. We're happy to answer them for you.